Good morning, this is Dr. James Dougal doing another presentation here from Johns Creek, Georgia on the coronavirus. I'm a board certified emergency physician, and this is Nicole Rahr, who's our paramedic and also one of our nurses here who works at Stat Medical Care. Now, you haven't seen much of us in a while because we've been so busy. We have a break in the action here. So what we're going to do is talk a little about Georgia, since it's in the news, and what we want to do is we're going to be opening up Georgia starting Friday to Monday, and we're just going to go over some of the basics again of the things to protect yourself. And as you can see here, the signs and symptoms of coronavirus have developed over the past month or 2 months. We found that there's a high fever. You do have a dry cough, which is very deep. We get shortness of breath, which is very common, tremendous fatigue, joint pain, sore throat, and then what we have found in each of our corona patients is they have lost, and 85% of our patients or around the country have lost taste, and they've also lost the ability to smell. And of all the symptoms that I've seen as a physician, this loss of taste and smell has been probably one of the major events in the coronavirus symptoms. Now, they'll appear within 14 days of the exposure. Do you have some tips there on coronavirus?
So some tips to keep yourself protected we've listed on here. Continue washing your hands as often as possible. That's eliminating the germ on the surface of your hands. Avoid touching your face, your eyes, your nose, your mouth. When you cough, cover your mouth. When you sneeze, cover your mouth. The virus itself is spread through droplets in the air. So if you cough or sneeze, it can go on to other people and get them infected with the virus as well. Stay at home if you have any symptoms or if you don't feel well. You don't know if you have the virus. You could be asymptomatic and spread it within 14 days before you show symptoms. So you don't know if you have it. If you don't feel well, just stay home. Protect other people as well as yourself. Continue to practice social distancing, keeping 6 feet between yourself and others. The virus, they say, can spread within that 6 feet, so you just want to keep a distance between yourself and anyone else that might be sick.
Those are excellent points, and we need to continue to do this, especially over the transitional period to when we're leaving and we flatten the curve, we're leaving the coronavirus towards seasonal, and we just have to change the way we do things. The world has changed. The other is the reopening of Georgia. As Nicole said, let's continue our safe practices. Don't feel embarrassed wearing a mask. Really, don't. You're protecting not only yourself, but you're protecting other people. Certain businesses are going to reopen. You can go to the Georgia website according to the governor. Look at the restrictions of the business, whether restaurants will open on Monday. You have gyms. Bring your own gloves to the gym. Bring a couple pairs of gloves. Wear your mask if you can. Stay distant from people. Clean the equipment. Clean the equipment. Did everyone hear that? If you use it, clean it. And clean your gloves also. When you get out of the gym, take your gloves off, because you don't want to cross-contaminate your gloves from the gym to the car, to the steering wheel. Clean off the steering wheel, the stick shift, and any other surfaces that you've touched. Enhanced cleaning. Screening employees. We screen here every patient that comes in, and we will continue. We're not changing at all here. We've separated our sick side and our well side. Each patient has a temperature. We get their vital signs, their pulse ox, and we get a history before they come in. There's no waiting room here anymore, and there's really no waiting at Stat Medical Care. You're moved into a room immediately. Gloves and masks for employees. I said this before. Finally, the people out in the centers for food services, especially food stores, have their employees in gloves and masks. That was the big hole I felt that coronavirus could sneak through and spread. Do you have any others about crowds?
When Georgia reopens, just keep in mind that you don't have to go out into public. You can still protect yourself, stay home. Try to avoid places that are going to be a center with a large crowd. Again, the 10 people or more recommendation still stands. When Georgia reopens, also if you're a vulnerable population, such as an elderly or someone with an underlying condition, stay home. Stay home, keep yourself protected. because you can still get the virus. It still will be there, although these businesses and centers are reopening in Georgia.
That's good. What about the statistics here in Georgia? She's compiled statistics for us in Georgia to keep us up to date. Nicole?
So Georgia right now has 20,166 cases total of coronavirus that have tested positive. Of those cases, there are 818 coronavirus-related deaths.
So coronavirus is still here. We need to open up. There are people who are just going through depressions at home. We're seeing that here. We're seeing a tremendous amount of increase in fractures at home. People are falling off ladders. People are riding bicycles in the house. Please be careful. Wash your hands. Continue not to touch your face above the shoulders. And if you have any problem, if you're waiting in the emergency room a long time, you really shouldn't be there. Come see us at Step Medical Care. We'll get you in and out. And if we have to send you somewhere, we will. Nicole, I appreciate it today. And everybody stay very safe. And we'll have another entry into the diary here of what we're doing at Johns Creek to fight coronavirus. Thank you very much.